To begin the surgery, your doctor will make an incision on the front of your knee. The kneecap or patella is rotated to the outside of the knee to help your doctor see the area where the implant will be placed. With the end of the thigh bone, or femur, now exposed, your doctor will use special instruments to measure and make precise cuts of the bone. The end of the femur is cut into a shape that matches the corresponding surface of the metal femoral component. This component is then attached to the prepared end of the femur. Next, the shin bone, or tibia, is prepared with a flat cut on the top. The exposed end of the bone is sized to fit the metal and plastic tibial components. The metal component is then inserted into the bone. A plastic insert or bearing surface is then snapped into the tibial component. The femoral component will slide on this plastic as you bend your knee. If needed, the kneecap or patella is also cut flat and fitted with a plastic patellar component. Your surgeon may choose to use cement to help fix the implants on your bone. Your doctor will conduct several tests during the surgery to ensure that the correct sized components are used and placed in alignment to ensure that the knee is balanced and moves well. Your doctor will rinse out the debris from your knee with sterile fluid and then close the wound in layers with stitches and/or staples. A drain may be placed in your knee to remove blood from the inside of the joint that can accumulate after surgery. The plastic drain is removed a day or two following surgery. When you awaken from surgery, you will be in the recovery room.